Oh, yeah, welcome to the YO.DH Health Dialogue, a podcast where we dive deep into digital health with experts from the field. Youth ownership of digital health is a community of young digital health professionals from across the world. Uh, you can click in the link in the description to become a member. Today's Digital Health Week and a Global Week of Action to promote digital health as a means of accelerating universal health coverage. We are dedicating each day of the week to a specific theme on digital health, and today's theme is climate change and digital health. I am Michael Kakande from the Resilient 40, your host for the session today, and I'm proud to that is hosted by Your Digital Health and Transform Health and Young Experts for Health. And today with me is Heidi Good, who is the project lead for the demand drive at Parts Digital Square. She brings over 20 years of expertise working across the international public health and development sectors, managing projects and partnerships that integrate community-based, user-centered approaches to support complex systems, build capacities, and foster hyper-local solutions. So Heidi, I know you've been working around the intersection of health, climate change, and technology. One would imagine that climate change is now considered a social determinant of health. My question would be is how do you see the digital health and climate change fields interacting and evolving? And if so, how can we use digital technology to respond to that?
Yeah, thank you. If I can also just start by my new title is Project Lead for Digital Square for Digital Public Infrastructure for Climate and Health. We have a new project with sponsored by Wellcome and the Rockefeller Foundation, really looking at digital public goods for climate and health. So some transitioning some of the previous work from our Drive Demand project into adapting national systems to respond to climate change, which leads right to your question. So, climate change poses a really urgent and significant threat to health, particularly for communities where health and economic disparities already exist. PATH is really committed to addressing these challenges through innovative solutions and partnerships that leverage digital tools and data to address those health challenges that come from extreme weather and climate shifts in climate change. So a key part of my work really focuses on those partnerships that identify, integrate, advocate for climate and health data to inform decision making for ministries of health and for global health leaders.
Oh wow, that's quite interesting. And of course, in there, the keyword would you be actions. So interesting to learn more on that, and probably to ask, are there any projects that you're working on, which are at the intersection of climate change and digital health at Path?
Yes, of course. So, as I mentioned, that we have new work that is sponsored by Wellcome and the Rockefeller Foundation um, to support the WHO, WMO, so World Health Organization and World Meteorological Organization Joint Office on Climate and Health. So, PATH is operationalizing the Joint Office's plan for advocating or advancing climate health services, climate health digital services. So that's taking on a few forms. One is sponsoring a climate informed health data track at the upcoming Global Digital Health Forum, which this year is taking place in Nairobi from December 4th through 6th. It's historically been in the United States, but with um, an option to join virtually. So we're really happy to have it in Africa for the first time. So as part of that climate health sponsorship, there will be a plenary looking at climate and health data services, a specific track on pulling together the climate informed abstracts, a couple of workshops looking at shared nomenclature and digital language across climate and health to see sort of um, what is a baseline data flow or data that would be needed across both climate and health architecture, digital architecture, and then also looking at related maturity models. So from PATH's side, all of this work really will be used to inform a global goods guidebook for climate and health that we'll be producing in about a year's time. And all of that will sort of culminate in this guidebook.
Oh
So that's our
wow,
central
that's
project. As part of that project, we're also doing other support for G20 and convenings around climate health. There's a lot of new work coming in, but that's my core focus right now.
Oh, well, that's super interesting because, well, speaking from the concept and perspective of the global south, it's always lack of data or lack of information. So it will be very interesting to look into such a guiding tool for such tools to be put to use by the communities that need to have them in place. And of course, we know all that to happen. Of course, is in response to the role of technology in advancing climate change mitigation, as well as digital health initiatives, like you clearly highlighted. What do you, in your own understanding, think would be the role of new technologies in playing the part of predicting as well as mitigating risks and responding to climate-induced health emergencies?
Yeah, I think there are innumerable opportunities. So, digital tools can be used to improve accuracy and reliability of predictive modeling. Using tools like GIS and satellite data combined with longitudinal meteorological and health data can be layered for greater precision response and responding to outbreaks or natural disasters. Combining both climate and health data can also be very useful in improved mapping, like, for example, to anticipate changes to supply chain or health workforce needs, other health system responses during, before, after a health crisis, as we look at the changing weather patterns. So that predictive modeling is really important to have a more accurate or appropriate response to extreme weather or the results from extreme weather, like flooding, et cetera. So I think using digital tools is really to our advantage to try to be as informative as possible.
Oh yeah, that's very true. And of course, we know that there is so much digital tools can help us, of course, in regards to tracking and, of course, responding to the ever emerging health needs as a result of climate change, as we've been seeing in the past few uh, months or so, an example of impacts. So it will be really interesting to see how such digital tools can be used to have a tally on that. But of course, while we are so much focused on technology, we know it's a very important component for advancing developments, of course, in the field. You have also been an advocate of social and behavior change, communication approaches. Can you, tell us a little about this approach and how it's being integrated in the climate change and health communications, if any? And of course, can you give us any examples of any campaigns, such campaigns that are running or, you know, should be running in the nearby future that you may have worked on, and any story of change that you may clearly have a good remembrance of?
Sure, I'm getting older, so my memory is not that great, but no, I will share with you a couple of examples. Well, the tools can exist, and we can adapt tools and have them available, but use of those tools is really important, and a lot of that takes social and behavior change or change management to get people using a tool, to not be afraid of a new tool. But the social aspect is really, how can we make sure that the tools are being used in the right hands at the right time to reach the right audience, right? So you had mentioned Drive Demand, which Drive Demand stands for Digital Results Improve Vaccine Equity and Demand. And that's the project that I was leading for the last 2 years, which was in 6 countries, really looking at adapting existing national um, electronic immunization platforms for COVID and improved routine immunization. So with those adaptations, we also started looking at how can these platforms further be used for climate health or climate aspects, both for immunization and other areas where health is impacted by climate. And a key piece of this work was looking at the social and behavioral aspects of what the ministries of health needed in those countries for those platforms to be really most usable. So, as an example, that work involved there are two parts that I would say are social behavior change related. One, Path worked with Busara, it's Busara Center for Social Research, to conduct small focus groups in 4 of our African countries, so in Tanzania, Zambia, Uganda, and Mali, really looking at intent to vaccinate, so behavioral intention. People may plan to be vaccinated or say they're going to be vaccinated, but we really wanted to understand what is the behavioral trigger and intentionality of vaccination and what gets people across that line to vaccinate their children. So we conducted focus groups looking at those vaccine drivers, intentionality, and triggers for uptake. And that's the results of that are published on our website as well as Busara's. We ended up creating a playbook of sort of best practices that can be used for social behavior change and use of digital tools for vaccination. So please go to our website, and I can provide a link to those findings. The second piece of that work was really, as I said, adapting these national platforms to best leverage appropriate messaging for behavior change. So, for example, in Thailand, we worked in very remote communities in the southern provinces that have been historically impacted by conflict, and looked at how Line, which is a digital tool, sort of a messaging service that's heavily used in Thailand, how the Line platform could be used to reach caregivers specifically to improve measles vaccination rates in children under 36 months. In Mali, we also adapted the DHIS2 platform, which is the national platform being used to track immunization records. We adapted that platform so that it could share messages both as SMS and audio, since there is such a high there's a low literacy level in Mali. And we wanted to make sure we were reaching caregivers who were making those decisions about vaccinating their young children with audio messages so that that wasn't a barrier. So we adapted that national system so that for this project and future projects, the Ministry of Health would be able to send audio messages in all of the local languages to support vaccination improvements. And these platforms can now be used for anything really related to health. So they can share and record messages about heat preparation, or how to prepare for, likely flooding or typhoon. Not a typhoon in Mali, but per country, you can figure out how these systems could now be used to support other heat or climate-related messaging.
Oh, wow, that's very interesting. And of course, when you talk about all this, one can clearly tell that there's need to be very huge data sets, of course, for these very interesting, very early warning systems, if that's the language we use in the climate change space. And so, just to clearly understand that, of course, we know that. These, of course, when I'm referring to the digital health and climate health, you know, both requiring very huge, amounts of data to support effective decision making, as well as for the early warning systems to be triggered to work. What do you see as a potential to streamline data flow into systems for decision making? Is that something you find reliable?
Yeah, I think that's something reliable, but I also think it's a really big challenge. It's something we're talking a lot about right now with WHO and WMO, and even ITU, the International Telecommunications Union, and others. There's a lot that I think we can learn from the climate, that we as health and digital health folks can learn from the climate space. Climate data, from the what I know of climate data, it is historically fairly templated. Um, across different kinds of areas or meteorological stations. That data is fairly templated, and there's solid longitudinal data. In health, it's a little bit different because the data collected per health area differs, and we don't really have a templated data set for all health areas across all countries. So part of what we're doing under this new project is to work collaboratively with WMO, WHO, ITU, others, and try to determine, is there like a simplified baseline standardized data set that we could use across both health and climate, to help those data flow processes and narrow down some of what needs to be captured, at least at a minimum data set, right? So we'll be hosting a workshop at the Global Digital Health Forum looking at a malaria use case. So with upticks in malaria, maybe in different areas than have shown up previously because of changes in rain patterns or changes in the amount of rain, and we're seeing an increase in malaria. How could the data from, from climate and health for malaria be, would it be used as a templated data set? And can we do this for other health areas? So I think the more we can kind of narrow things down and use a targeted set that is shared, that would be very, very useful to this space. But again, it is complicated. So trying to figure out what is that minimum.
Oh, well, that's really interesting. And of course, when you're talking about data, they're all data controls. So who has access to this data and who keeps this data? So in this context of course, data, of course, we know, and in the wake and reality of climate change, we know that it highly, affects the low middle income countries. And uh, at the same time, we know that the benefits of digital transformation are not equitable for all people, even in the same populations. So just to ask, how do you see that the need to reinforce equitable digital transformation to support vulnerable communities and not exacerbate inequities, because there's already been very big gaps when it comes to equality. So how do we use this not to create more inequalities?
Thank you for that question. It's really important to call out, in addition to economically vulnerable communities, we know that climate change disproportionately affects women, Indigenous people, young people, who will inevitably face the brunt of the burden of climate change. So, at Path Digital Square, there are a few ways that we try to counter this or help counter this. One is to foster digital literacy and capacity building to support that equitable transformation. Um, we know that there's a huge gender gap in digital health, and women make up approximately 70% of health and social care workforce, but there are almost 800 million women who do not use mobile internet, and 60% of them live in South Asia, sub-Saharan Africa. So, and I'm pulling those numbers from the GSMA Mobile Gender Gap Report, which I really like. Their research tends to be really key. So for millions of women and youth and those who are more marginalized who don't use mobile internet, that lack of digital literacy is a real challenge. In addition to just the structural challenge of maybe access or the gendered access issues around sort of use of some digital tools or use of mobile phones. So building that digital literacy and capacity building is one key priority area. Another is supporting really localized inclusive policy and governance to ensure that digital transformation efforts are equitable, with strong political leadership and inclusive policy. So, that is very cross-cutting and far-reaching, but trying to facilitate those conversations, supporting those policy changes, and just bringing to light some of these challenges is a lot of what Path and Digital Square try to do to support equitable adoption of strategies.
Oh,
Maybe I'll leave it at that for now.
that's very interesting. And of course, when we talk of the disparities and gaps, of course, in the context of the global south, we've been so much advocating for gender responsive approaches. So these are also very good avenues to further work on that. And of course, um, from your work, of course, from your history doing this amazing work within Path and other areas, what strategies, honestly, do you think governments should adopt to ensure healthcare resilience in the backdrop of climate change and equitable access to infrastructure? Because that's been one of the very big issues as well.
Yeah, again, I think Path really wants to support local ownership and local leadership of digital solutions and that are culturally appropriate and locally created. So again, a lot of what we do is to support strengthening of intersectoral collaboration and financing, promoting one health for climate and health, supporting use of digital public infrastructure for health and for climate health specifically, trying to support adoption of strategies that incorporate these One Health principles, like, for example, for surveillance and management of zoonotic disease or antimicrobial resistance, other health issues that are impacted by or exacerbated by climate change. Also supporting investment in digital public infrastructure, as I mentioned, but that's a really important area, I think, because it can facilitate more equitable access to health services, and improve health data management, enable real-time response and capacity and capabilities in the face of extreme weather. So those are a couple of key areas. And last, just supporting research and helping to build and provide an evidence base around use of digital tools for health or for climate health as a growing area is important also to then inform that policy and policy development for that local leadership and ownership. So I think those are some key priorities for Path and Digital Square that are very much on my radar as part of this build up for improved local leadership around climate health specifically.
Oh well, that's super interesting. Of course, in reference to locally led structures and practices. So that's a very big uh, opportunity there for everyone else to tap into. And just to also close in on probably more on the work that your organization is doing to address gaps, around all that we've discussed. Probably, are there any clear examples of works or programs that your organization is doing your end to help, you know, just around digital transformation as a whole?
Sure. Well, I won't cite programs or projects specifically, but as an organization and as an initiative, again, we work very closely with ministries of health and local governments to really build and support strengthened local leadership and government around digital health and digital health transformation. Um, we have a number of programs and projects that support technical capacity building and infrastructure for digital health. A lot of coordination and collaboration to foster financial investments for digital health, and more and more addressing climate impact through digital tools. I think this global goods guidebook for digital health and the processes that we're using to create that guidebook will be very informative as sort of this next year will be very informative to then lay out stronger climate health responses over the next 5 to 10 years. So there's a lot that we're doing sort of as a full ecosystem to build into that's strengthen digital health transformation.
Oh wow, that's interesting. And yeah, uh, congratulations on the work that the organization is spearheading. It's very interesting work and work that needs to be done in this very, period of time when in the wake of all these global climate and ecological crises. So it's very interesting work that you're doing your end. And just to be technical and probably more fun, what are your hopes? What are your hopes for the future of digital health and climate change? What is that something you would like to see?
Good question. Thank you for that. Well, I mean, I'm so impressed by the work that you and your group are doing. I mean, part of my focus is really how can we ensure community voices, young voices, country-based, youth are being heard and informing this conversation. So, how can I help bring up those voices and amplify that into a larger stage, and make sure that these voices are really heard by policymakers and those sort of maybe at the top or who have been in their positions for some time. So that's really important to me, sort of that community-based focused and the youth focus to bring. To help make some of these things a little more visible than maybe they are outside of a country-based or regional based lens. So that's one component of my work that I think is important.
Wow, that's very interesting, and of course, it's interesting to learn of. There's so many initiatives out there by young people trying to take the lead in digital health, and of course, the nexus around climate change as a whole. Fact that we know it affects all sectors, so it will be interesting to learn more and the available opportunities for young people, youth, specifically women, and all these other groups can really tap into in the wake of this of available opportunities for the world to work together to make global health coverage a priority, unlike how things have been. So we'll dive into some quick rapid dialogues on trying to get to know Heidi and in our private times and what she adores most apart from her work side of life. A quick one. What's that one technology you can't live without?
Oh, my phone. I'm so addicted to my phone. Yes. Use it for everything.
Interesting. Interesting. All right. Handwritten notes or digital ones?
Handwritten. I don't write enough of them, but I hope it is not a dying art.
So you have your notebook or it's close by.
I do
Interesting.
always.
Uh, when is the last book you read?
So I'm a real nerd, and I usually have at least two books going at a time. So I use more like a fiction or kind of fluffy book while I'm running, just to listen to. But I always have kind of a nerdier, a nonfiction book going that I can actually read and take notes in. So right now I'm reading again "Invisible Women: Exposing Data Bias in a World Designed for Men." It's a fascinating book.
Oh, wow. Indeed, indeed, very powerful books there. And okay, what is the last thing you asked ChatGPT?
Oh, geez. I've been really into weightlifting, so I like using ChatGPT to help me figure out, like, what exactly I should be eating, to be optimal have optimal nutrition for my weightlifting. I tend not to use ChatGPT for work. I probably should. It would probably really save me a lot of time. I'm still, I have some digital change management to using ChatGPT as an adopter.
Oh, wow, that's interesting. ChatGPT making lives easy, uh, but good enough to know that not in all areas yet. So uh, we know you share a passion for photography. Um, what are any of your favorite moments or favorite photos that you've captured?
Oh, I love looking at other people's photos from around the world. I still love National Geographic, but for photos I've taken, anything that has my kids laughing, that's what I love the best.
Ah, that's interesting. So a camera has to be very close because kids are very interesting and very funny beings that always share their joy with everyone around them.
Yeah, and
That's
for
very
better or worse,
interesting.
that's my phone these days. So my phone is my camera. It's
Exactly.
always in my
A
pocket.
phone, a phone that is always close by. Okay, and the last one thing you tell, okay, one thing you would like to tell any young women inspiring to change, to create change.
Yeah, I think it's not to it's not it can't be a gendered question, right? I would tell anyone, young boys and girls, that just to have confidence in yourself and to go with your gut, and ignore boundaries. You can break rules, and just have confidence in yourself to do the things that you feel are important.
Wow. Well said, Heidi. To every young woman, man out there, just believe in yourself. It always starts with the first baby step you take, and that will be your right direction to bring about change within your community and your family. It's been a pleasure talking to you, Heidi, and yeah, we look forward to more of these. And to our subscribers, to those watching, please, the link is into the subscription for you to join your digital health platform for more of these interesting episodes. So, just to thank you, Heidi, and thank you so much for coming through to share with us your very interesting journey.
Oh, thank you so much, Michael. And I look forward to the podcast where you are being interviewed to hear more about your work and your great work with youth and climate. There's a lot that I can learn from you, so I'll be waiting to hear that episode too. Thanks
Thank
so much for
you.
your time today.
Thank you so much. Thank you so much.